Hi, welcome to Proving Cures. I'm your host, Sarah McLeod. I am a clinical research specialist and a medical writer. Oh, today is Wednesday, October 16th, 2024, and I am dedicating this video to my fellow PCOS girlies. I have been seeing a lot of videos on YouTube with other young women saying, they have this diagnosis of PCOS. A lot of them are battling obesity as a result of it. I am particularly impressed because when I was diagnosed some 30 years ago, so little was known about PCOS. Not even the doctors knew how to ascribe proper treatment. And what I'm going to share with you right now is just a little walk down memory lane before I actually dive into what PCOS really is. Because what I'm noticing is doctors still aren't explaining to young women what these diagnoses really mean. But I'm going to share my story before I dive in. So, when I say PCOS girlies, I'm not just talking to you. We are a tribe, we are a community, and I'm one of the oldest members of the community right here with you, and I want to help you just like I'm trying to help myself just by sharing my story with you, so maybe you don't fall into a lot of the same pits that I fell into when a lot of people who I had to depend upon for help themselves were uneducated about the disease. So I was originally diagnosed with PCOS by intravaginal ultrasound at the age of 15. I remember the doctor not even talking to me because of my age, looking over at my mom and saying, I remember the word hearing the word pearls. She has these pearls on her ovaries. Pearls, like there's something nice and beautiful and and sweet about it. These pearls, they were cysts. He saw a bunch of cysts on my ovaries. And this was after a year of not seeing my period. And at that young age, I'm thinking, oh, I'm not having a period. Gym is great. I don't have to deal with my stupid pads and tampons. I wasn't wearing tampons, but you know what I'm saying? Like, I didn't have to go through the misery of the period. So I didn't see anything wrong with it. It was my mom who noticed I wasn't asking her to buy pads. And she's like, when was the last time you saw your period? Like, she's looking at me like, what is really good? And I'm like, it's been a while now. But I didn't want to tell her because I'm thinking it was, it was cool. And that's when she took me to the doctor. She took me to the OBGYN, and that was the diagnosis. So time goes on. I remember after having given me that diagnosis, first thing OBGYN does is prescribe Depo. I believe it was a progesterone hormone, progesterone mimic, in tablet form, and this was prescribed right before we were going on vacation. We went to Jamaica, and I never even got to go to the beach, guys, because I bled for 1 month straight with Depo. That doctor never said that was going to happen. He said he was prescribing that to get the period going again, but that's it. He didn't say the period was going to last for a whole month. So that was like awful, being homebound the whole time while you're watching your family like go out and have fun and do fun things. So that sucked. And that was ages 15 and 16. So now there are two kinds of PCOS. I call us victims of our own bodies. There's those of us who suffer from obesity all of our lives, and then those of us who don't. We all, however, have excess androgens in our system. So one thing I discovered, I used to be jealous of the ones who don't have the obesity issues, but they have other issues too, especially like hirsutism, the excessive hair growth, the male pattern hair growth. I remember getting laser laser therapy for my hair, which still grows in nowadays. It's just another one of those things. But the battle with obesity has been going on for me most of my entire life because of PCOS. You never can get away from it. Let me see. Let me tell you what was the next pivotal thing for me. So, age 21. Age 21 was the next pivotal moment for me with PCOS. I went to the OBGYN, another OBGYN. OBGYN says with a straight face, and mind you, this is an OBGYN, a fairly young black woman who looked at me with no sympathy whatsoever and said, "You'll never have any children. You don't ovulate. You won't have any children." And that was it. She didn't even mention PCOS. She didn't know anything about PCOS. She immediately put me on an oral birth control pill to get my periods going. That pill felt like it was going to kill me, and I have never been on a birth control pill since. I started to get blood clots in my legs. The bleeding was so excessive. It was taking away my ability to stay awake. I was falling asleep at work. I was scared to drive. It was bad. I had to take myself off of it. When I told her about it, she said, "Your symptoms came on entirely too fast for it to be attributed or attributable to the birth control pill that I gave you. It had nothing to do with what I gave you." Mind you, that was the only change in my life, that pill. As soon as I stopped taking that pill, ladies, the symptoms went away. My energy came back. And before this happened now, before I even started working in clinical research. But what I did, I started to do my own research. I recently graduated from college. I knew how to do my own research. So I started to go online and I look up information about PCOS. And what I discovered, first and foremost, was that it was not a gynecological problem. Unlike what most of us are led to believe, it is in fact an endocrinological problem. A problem with the hormones in our bodies. And so the best way to find treatment at the time, for me, was to find a reproductive endocrinologist. I had really good insurance with the contract position I was working with the federal government. I had really good insurance, thank God, because she was an expensive doctor. As soon as my contract ended and my insurance ran out, I couldn't go to her anymore. She spearheaded her own clinical trial, and I became one of her subjects. She prescribed for me metformin to regulate my blood glucose and the insulin levels in my body. I believe the prescription was 500 milligrams twice per day. It was a very long time ago, age 21. I'm in my late 40s now, so I can't tell you specifically how long I was on that protocol for. But I can tell you that I lost approximately 70 pounds. I looked great. I loved everything. I remember going to her in tears. I was at my highest weight at the time of 317 pounds. So to lose 70 pounds was huge. I remember joyfully giving I had really expensive suits. I was a writer for the federal government, not doing bad for myself by any means at that age. And I remember being able to just give away my suits to other women who I knew could use them. And I felt so happy and so proud to be helping other women, But I had no idea that the control of PCOS required staying on metformin probably for the rest of my life, or at least at intervals, because PCOS in and of itself causes you to retain weight. It is a horrible cycle. I wasn't able to stay on it. After losing the weight, I would say within 3 years, I regained the weight. Regained some of the weight. A great some of, great some of the weight. At that time, I was on to another job. I remember one of my physical role models, may she rest in peace, Anna Nicole Smith. I say physical role models because when she was heavy set, our bodies kind of look alike as far as height and the way we're shaped. And she actually started to advertise a phentermine based appetite suppressant that was sold over the counter. And I ran and got it. I said, if it worked for her, it's going to work for me. We look just alike, body wise. I took it. I took one pill of it. Got up, took a shower. My heart starts beating like crazy through my chest while I'm in the shower. But you're young, you're strong, you ignore stuff. I went to work, got through the whole 8-hour shift, and didn't go home. Ended up in the ER, completely dehydrated, heart rate through the roof. I wasn't clinically inclined at that time. If it was now, I'd want to know what my heart rate was and this and that. No, I just wanted to know whether I was going to live because it really did feel like I was going to die. And I don't think I told anyone. I don't think I told anybody. I just went home late that evening. Stayed in stable condition, thank God. And I threw away the rest of those pills. I think that was probably 2005 or something like that. So that didn't work for me. I subsequently after that I bought a elliptical machine. Brought it in the house. Started using the elliptical machine. I got muscle strength. You know, my body looked what's the word they use? Proportioned. Well proportioned, but I was still overweight. I still wasn't losing the weight. I didn't understand it. You know, my insulin levels were out of control. My blood glucose was not under control. It's the PCOS, state of prediabetes. But nobody explains these things to us. Now it's 2024. Now everyone has a phone, a camera on their phone. They have access to the internet. They're doing videos. And I'm hearing of so many other women, young women with this issue. And they still don't sound like they understand the disease. So I decided this is kind of a great time for me to do this video. If you see me turning this way, it's because my computer is over here. And I did a quick write-up on what I want to talk about today because I might miss something. But it's at the top of my mind, so I probably won't miss anything. But if you see me turning this way, you know why. So, first thing I said that I'm going to reiterate because it's so important. I want you to get this in your minds. Polycystic ovarian syndrome is not a problem with your reproductive system. The problem with your reproductive system is a symptom of PCOS. PCOS, the pathology of PCOS, the disease progress, the beginning of the disease and the progress of the disease is a disease of your endocrine system. Okay, where do I start? So you have the hypothalamus gland. The hypothalamus gland, see, I'm looking over. The hypothalamus gland triggers the pituitary gland. So it's a neuroendocrine signaling system. One gland signaling the other gland to do XYZ. So your hypothalamus gland, and this isn't all women, but just follow me here. The hypothalamus gland signals the pituitary gland to release two sex hormones in women. These are the luteinizing hormone, LH, and the follicle stimulating hormone, FSH. These hormones now, once they're released, they cause the ovaries to stimulate follicular growth and produce its own sex hormones. Okay? Now, in normal women, those hormones would be estrogen, also known as estradiol, before ovulation and progesterone after ovulation. That is why the OBGYN put me on Depo, because I wasn't ovulating, so I couldn't produce my own progesterone. And by her doing that to me, she caused me to bleed for an entire month. All right. Anyway, this signaling system is called the HPO axis. HPO stands for hypothalamus, pituitary, and ovarian. The HPO axis. Now here's the deal. I'm scrolling down here just so I don't miss a step with you guys, because I want you to understand the way I understand it. So now with us, our ovaries aren't producing the estrogen and the progesterone they need to produce. Or they'll produce estrogen, but they're also producing testosterone. And not only the ovaries, the adrenal glands also are producing male hormones, which are in total referred to as androgens. We're not supposed to produce these androgens, guys. So the tissues and what the androgens do to us now, they cause the tissues in our bodies to become less sensitive to insulin. With this decrease in sensitivity, the pancreas reacts and produces more insulin. So now we have all this insulin in our systems, which causes two problems. Follow me. The first problem the excess insulin does is puts our bodies into a state of pre-diabetes. All of us with PCOS have metabolic syndrome, which is also known as pre-diabetes. If we don't get this under control, we will become diabetics. And that's no joke. Now, pre-diabetes, the state of being pre-diabetic, also puts us at increased, very severe and high risk of developing cardiovascular disease, heart disease. You know why? Because we are developing visceral fat. It's the fat you can't see. It's the fat that surrounds your stomach, your liver, and your intestines. That development of internal fat puts us at risk for heart disease. That's the first thing the excess insulin our bodies does. The second thing it does is stimulate the ovaries to produce even more androgens. So that's just a cycle. And that vicious cycle is what PCOS is. Okay? So the hypothalamus stimulates the pituitary gland. When the pituitary gland is stimulated and it's releasing the LH and FSH hormones, the ovaries get happy. They start, and the adrenal glands get kicking. They start secreting androgens, and the cycle goes around and around. And that is what PCOS is. So now this takes us to, why am I choosing to go the GLP-1 agonist route, and that is with semaglutide? Well, here's the thing. Here's what I discovered. First things first, a lot of you might see this and say, oh, you're crazy because XYZ problems have arisen with women taking semaglutide, specifically gastroparesis. I see there's some class action lawsuits floating around for people who've taken semaglutide and have since experienced gastroparesis. That is a serious issue. Also, I'm not going to dive into all that right now. I'm not going to dive into the side effects and adverse events now, because I'm going to do that for a second video to accompany this video. Those things are real. And I am a research specialist. So it's my job to go in, especially for my own health anyways, because I have my appointment with the nurse practitioner to discuss the semaglutide Friday of this week. So yeah, this is serious business for me. But I'm definitely diving into research to look at the real side effects and to see how I can mitigate those side effects. And I also don't plan on doing this longer than 6 months, because from what I've read so far, you get over 6 months, you run the risk of gallstones, which is bad. It's not something to play games with. So yeah, I'm just doing it for 6 months. And like I said, I'm going to do a follow-up video to go over side effects and how to sidestep those side effects. So anyways, because there are ways. But here's the thing. So semaglutide is known as a GLP-1 agonist. It is now I'm reading, and I'm going to share in the description the title. Well, I'll tell you right now, but I'll also share the description what this document is, so you can pull it up for yourself and read it in the future if you so choose. The title of the document is "Do GLP-1 Analogs Have a Place in the Treatment of PCOS?" So it's directly for us. New Insights and Promising Therapies. It was published September 12, 2023, so it's fairly new in terms of being a clinical publication, and the journal is called the Journal of Clinical Medicine. All right, and GLP-1 is an incretin hormone which exhibits the capacity to stimulate insulin secretion in a healthy manner, in a glucose-dependent manner. So the principal effect of GLP-1 analogs is similar to that of the natural GLP-1 that the body creates on its own. As all synthetic GLP-1 receptor agonists bind to the GLP-1 receptor, eliciting glucose-dependent insulin release from pancreatic islet cells. Additional benefits of GLP-1 analogs, as you've probably already heard, is that they delay gastric emptying and the inhibition of glucagon production by pancreatic alpha cells. That's the main reason why, because it's going to bring this horrible cycle of excess insulin secretion under control, all the while helping to suppress my appetite, while helping me to lose weight, which scientifically sounds like it's reversing the pre-diabetic state of being. And that is why I'm going that route. And I'm going to, along the way on this channel, especially if you guys ask me to do it, share how the journey is going, especially in regards to as well side effects. Yeah. So I'm going to end it here. At the end of this video, you're going to see an ad. You're going to see an ad for my sportswear pieces. Please, by all means, my pieces go up to a size 6X, so you can wear them. They fit everyone. I think they start at extra small and go to a 6X. This is one of my workout tops right here. Yeah, but this is really serious. It's pretty somber, actually, just thinking over all the years of difficulty of fighting obesity, the uphill battle of fighting obesity while your body's fighting me. Yeah. But look out for part 2. Thanks for watching.